Dr. Vanessa, I am so happy that you're here. In a second, I'm going to ask you to actually introduce yourself. But I just wanted to say, I remember the first time I saw you.
Oh
I
gosh.
was actually, I know, I saw you, I was at Positive East actually in East London,
Yeah.
and you were doing a talk. And around that time, that was when I was in my underground stage, when I told no one about HIV. I was so underground and I didn't want anyone to see me. But I saw you and I remember feeling a sense of, oh my God, there's a black woman talking about HIV. And I felt a sense of just connection. I just felt, I don't know, safe. Like there's people like me, like just talking about it. At that stage, at that phase in my life, I was just in shock and probably depressed and not knowing it. But
Yeah.
seeing your image just made me feel a little bit safer. So,
Oh.
yeah, I just wanted to say that. I've not said that to you before, but I wanted to say, and I'm really glad that you're in the in the in this field, and which brings me on to, can you tell me, like, introduce yourself and tell me about your journey, first of all, into kind of becoming a doctor, and then what made you get into HIV?
No, okay, no, definitely. So first of all, thank you so much for telling me that. That is really beautiful. Yeah, touched me as we started, and I think it's really important to hear, for me on a personal level, but I think also for other people listening, that, you can be going through that time and there can be just one moment that can just give you a bit of ease. And on those moments come. So no, thank you so much. So it's great to be here. So I'm Vanessa Appiah. I'm a consultant in sexual health and HIV, and I work in East London, born and raised in East London, actually. So I'll go into that. And exactly. And I also am an honorary senior lecturer at Queen Mary University of London. And lots of my work looks at really all about health equity and how do we make sure that everyone gets the care that they receive, and particularly for Black populations and for women as well. Um, so me, yeah, so I was born and raised in East London. I was actually born at the Royal London, so my life has come. I'm joking. How wonderful. Yes. My life has come full circle. So my journey to being a doctor is funny. I feel like I've always got a bit of a cliche story. Because many of my family are in the health profession, so nurses and
Yeah.
midwives, and that was really core to me. But actually, when I was about 8, my little cousin had a accident and
Yeah.
significant burns on her body. Um,
Uh-huh.
was looked after in Billericay in the burns unit, and I
Yeah.
really distinctly remember the excellent care that she had. And so
Yeah.
my mum always says, and I do remember it, I said, "Oh, I'd love to help people in this way. I'd love to be a
Oh,
doctor." And then
yeah.
uh, typical, Ghanaian mum from Ghana. Well, you're gonna have to work hard then. Yeah. Moved into that, but yeah. So I through secondary school,
Yeah.
my standard A levels, but I think the thing about medicine and going into
Yeah.
it, that there weren't many people that looked like me.
Yes.
Did have a village behind me, of
Yeah.
extended family and friends who were just really behind me. So even though I didn't have that representation of who I was looking toward, I had
Yeah.
people behind me and around me looking after me, just saying, it's different. You may feel alone in that space, but we're here with you. So yeah,
Mm.
yeah.
So, I always say that, like, sexual health, HIV sexual health, I think is just so interesting,
Mm.
isn't it?
It,
It's
it, it is. Oh, I love it.
just not about sex, is it, really? It is, but it isn't.
Exactly that. And I think that for me as well, so you through medicine, like you go through like different medical rotations and you do different.
Yeah.
And when I came into sexual health and HIV, I was actually going to specialize previously in cancer and oncology. So I thought
Uh-huh.
my route. And my
Mhm.
last job in my rotation was sexual health and HIV. So I thought I was just going to do it,
Oh, yeah,
on, and then I loved it. I think it's about creating safe spaces where people can be completely open
yeah,
about
yeah,
what they do, what they enjoy, what they don't enjoy, um,
yeah,
things that have made them perhaps vulnerable, things that empower,
yeah,
and
yeah,
support them through that.
yeah,
And when I first started, I was it was about over 15 years ago within HIV, and
yeah,
it was at that point that antiretrovirals were just um, uh, uh, combination therapy was
yeah,
just coming into its own. So
yeah.
definitely, I still saw a lot of people with advanced infection, filling our wards, and the care, the approach, the
Mm.
relationships through that were really key to me, and it was really kind of drove me to stay in the specialty and work forward. So yes.
I think, what you said there about like late diagnosis. I was thinking recently that, most people would agree with this saying that knowledge is power. Most people would understand that when you have knowledge, it gives you power, i.e., it gives you choice, and choice helps you make decisions.
Yeah.
You can choose to do nothing or you can choose to do something. There's no right or wrong way, but you have that knowledge. Nobody else but you.
Mm.
And I think to myself that you go to the dentist to get your teeth checked. You go to get your eyes checked. If you're female, you go for your smear test, or male, maybe a prostate. And I understand why people don't want to get teeth checked because, some people are kind of concerned about the dentist and the pain to do with dentistry. But actually, when you think about a HIV test, some people just don't want to have the test. They just don't want to have it because they don't want the knowledge. I think, and it forces you to deal with something. But I think I just kind of just want to make the point that unlike going to the dentist, it's not painful because it's not painful physically because you just tapped on late diagnosis, and that's something that really kind of worries me and concerns me because I've met like you many people that got diagnosed late, and you think, oh,
Yeah. No, I think you've said so many powerful things in there. And first of all, yes, knowledge is power. But I always think with knowledge and from knowledge to decision making and acting on it, it's a journey. And
yeah,
people will go on that journey really quickly and smoothly and feel really rational about it and confident about it. And then others will have different levels of confidence,
yeah,
trust through that. And that can then affect the length of that journey. And, you know, knowledge and acting on it is really shaped by what's around you and your
yeah,
experiences in life, what you've seen your family and friends go through, what
yeah,
the media, what's happening in your life in terms of education, work, finances. And so
yeah,
it is so complex. And but when you break it down, as you've said, that you go for a test, and there are many ways to test, whether you're doing
yeah,
a mouth swab or you're doing the finger prick. And yes, if the test is reactive from those, you will need to go on to have a blood test from one of your
yeah,
but and many people don't like needles. I understand that. um,
yeah, yeah,
it's minimally painful, let's put it that way, not
yeah,
as,
yeah,
and it can give you that knowledge to make sure to support you to thrive in the best way for you. So if you are negative and you're not
yeah,
living with HIV, then it gives you the knowledge, right? You're not living with it. How do you stay negative? How do you support yourself, etc.? But if you are living with HIV, it gives you the opportunity to get onto treatment ASAP, but also be wrapped around in that support that will make sure that you can live your best life ASAP.
yeah,
Um, but it is inherently complex for many people, but I think this is why I love doing podcasts like this with people.
Yeah.
It's let's simplify it and say,
Yeah.
take the test, get the knowledge, and let's support you to live your best life. Yeah.
There was something that you just said there. Yeah, I was just thinking that um, um, you cannot underestimate the reasons why people don't want that knowledge. Because let's just put HIV to one side, let's put sexual health to any STD. People don't want to know they've got something. Because if you don't know, there's an ever saying, isn't it? What if you don't know, it don't hurt you? That's an ever saying, and I'm going to push the envelope here and say, if your partner's having an affair, maybe you don't want to know. If your kids are on drugs, maybe you don't want to know. And it goes on. So I would never underestimate the reasons why people don't want to know.
Yeah.
I think that faces, women, of colour coming out there saying there's a village behind you. You're not alone, not just to the Black community, all communities, but I know the intricacies when it comes to, Black and minority kind of communities. It's just so intricate,
It is. It is so, and I think that we haven't used the word stigma yet, but it's there, it's palpable, and it pervades everyone, every color, gender, sexuality is there. But I think that we can comfortably say that in people, Black communities, other minoritized communities, there's a certain level of stigma that compounds things that really can really inhibit someone to have that, to go and take that test. And again, reinforcing the village comment, not everyone knows that they've got a village. And I think Black communities, they'll know they've got their friends and family, but when it comes to things like an infection, things like a diagnosis, they don't feel confident that their village will still stay there.
Yes.
And that's it. And so they're worried about losing their status in that community, their power, their that comfort that they get. They're worried about that being pulled right from under them. And I think, as you say, you can't underestimate that. And a lot of the work that I think many services do, a lot of the work that I'm really focused on doing is just saying that there are people there for you. And there are many people that are there to support you, that are in the same situation as you, or there are allies with you that are going to be able to support you with taking medication, with attending appointments, feeling confident about yourself. I think that's so important to get out there.
So there was something that you said. So yes, I was going to say this. So I've heard, someone told me who works in the medical profession that there are some people. I like calling you Dr. Vanessa. I know it should be Vanessa, but I like calling you Dr. It feels so cool, right? There are some people, Dr. Vanessa, right, that won't pick up their medication because they're so embarrassed and ashamed, just to go and pick it up, and they do without. That's just a tip of the iceberg. Let's get into stigma and let's talk about community here. Where you said that, some people, they rely on their community, and coming out and saying they've got an STD or HIV, they're concerned that the community won't be around them. And the thing that comes to my mind is, you're never really going to know how your community is going to react. Community meaning friends and family.
Yeah.
But one thing I feel strongly about is if your community, your friends and family support you, that's nice. And if they don't, that's okay, because I've got this thing at the moment about saying that we are all individuals. I'm different to my mum, to my sister, to my son, to my daughter. I'm different. They're different. the community, I know, when you understand community, that there is a connection that keeps us together, but we are all different. So therefore, you can't force or expect somebody to behave the way that you want them to. So there's something there, especially with HIV, to kind of, I don't know what I'm trying to say, but do you know what I'm trying to say? When you worry about your community.
And I think it's interesting. So I'm trying to think of, some of the language that I'll talk about when I'm speaking to someone that maybe is in an early phase where they've just been diagnosed and they're coming to terms with it. And, some of the conversations, very similar to what you've just said, is that we, in life, it would be wonderful that people, I always make a joke, it'd be wonderful that my husband would know exactly what I'd want him to do, when I want to do it, and respond to all of my emotions in the way that I want him to, but does not happen. And, we hope that people will say X to them, and we want them to say Y.
Yes.
Some people will say Y, but they'll say Y a couple of days later, a couple of weeks later, a couple of years later. But in that time, whilst, or they may never say why, they may never want. And in that time, I think you're right. A person has to make a choice. Are you going to wait and hold your life by waiting till you get what you need from them? Say that it would be wonderful if they gave me what I need, but if they don't, I'm still going to be okay. And I'm still find what I need for myself, and then actually build other connections that are right for me. With people and things that I never knew existed yet. But I'm going to forge that. But I'm going to be confident in myself, and then what comes around me, great. But I can do what I need to do. And I think that so I think that is really important, because at the end of the day, it's you taking your pills. It's the appointment. And it's so there is a lot on you. And it's important that those around you work with you to solidify you, strengthen you, and not to kind of strength away. But it's, again, like everything, life is complex, and some people will listen to this and get it and feel, and then some people are going through a space where actually it feels too hard, and they and that's all right too. But it's about finding spaces for you to get that support that you need.
Absolutely, because I say, and I have to make this point, I need to labor the point that I was, when I found out I was so low, unbelievably low, for years, not like 1 or 2 years, like for 10 years, I was underground. I dissociated from my body. I was embarrassed. I didn't want people to know. I was in a senior management position, so I didn't want no one to know. To this, I'm out, so it takes time for different people. And stigma. I wanted to ask you about stigma. 15 years ago, when you kind of started in this field to now, what are you seeing in terms of male, female stigma? What are you seeing?
So, first of all, just to say, it's amazing your journey. Like, the fact that you're it's just beautiful that you're here and you're saying it, and like you say, I'm out.
I'm out.
And that representation and that just openness, I think, is incredibly powerful. So no, thank you. But I wish I could say that the level of stigma that I viewed many years ago has changed significantly. And yes, there have been some improvements, and but it's still looms large. There are, and I think, like everything, people are individuals. Everyone goes on their journey of knowing HIV, understanding HIV, being prejudiced against those living with HIV, and then more open and understanding. And so, trying to manage all of that in globally and populations is a lot. But I think that stigma is really palpable. And for me, one of the ways that I measure it is one of the things that really struck me when I first started working in HIV, and something that really pushed me about advocacy and just out there, was because I found so many people living double lives.
Yes, yes.
And it's exhausting living one life.
Yeah.
Living a double life,
Yeah, yeah,
it used to really, really pain me.
yeah, yeah, yeah,
I'd have people coming to clinic and they'd like either scurry in or
yeah,
completely laser, didn't want anyone to see, looked so uncomfortable in the waiting room. You see them in the consultation room, they will open up. They may go through different emotions, and let's say someone in the clinic is, crying, and then put on their makeup, make themselves more presentable, and then they're out. And when you
yeah,
would never know what they've been through. And
yeah,
as human beings, we are made up like that, where we kind of get ourselves together and get out there. But what used to pain me the most is that often people living double lives were not getting any support about
yeah,
diagnosis and what it meant to live with HIV.
yeah,
So they were disempowered, lonely, living in shame, and no one deserves that.
yeah.
You know?
There's two things that I'm got to say. You just said that, what it means to live with HIV. Maybe I'd love to do another podcast with you with just like step by step, what does it mean? You do this, you get your blood test, really succinctly. So,
Yeah.
and I was also going to ask you, about maybe, if you notice some of your customers, for want of a better, or patients, talk about particular subjects, you could say to them, look, I can do a podcast about that if you want. And then maybe we could do that, as a response, and then kind of refer them there if it's something specific. But anyway, that's separate. I'll talk to you about that afterwards. What I wanted to say is, did you have a role, Dr. Vanessa, in this HIV Zero Stigma Day?
I did. Yeah.
I said, and a little birdie told me you had a big role in that. Did it
Yeah.
come from you? Yeah.
Yeah, no, that was that day was amazing, actually. So first of all, it's a many years coming into fruition, and
Yeah.
and the the reason that I had a big part to play with it was actually because of, I think, the fantastic sector that we work in, and
Yeah.
it gives you that energy because you're around so many people like yourselves, activists,
Yeah.
advocates, that are saying we need to change things, and how do we do that, and how do we do that on a global scale as well.
Yeah. Yeah.
One of my roles is that I'm on the medical board of NAS, Project
Yeah.
London, which is a charity organisation that
Yeah.
supports people living with HIV. And we had a meeting and we were talking about different initiatives, and I said with the then CEO, Parminder, it would be fantastic to have a day that we could
Yeah.
put together, not only in the UK, but
Yeah.
also globally, for zero HIV stigma, because
Yeah.
we've got zero discrimination, we've got World
Yeah.
Day, etc., but just
Yeah.
a day that's focused on stigma alone.
Stigma.
And
Yeah.
also the fact that, every day, it would be wonderful if every day of the year we had something to say, let's get rid of stigma, let's remember,
Yeah.
just be relentless and really quite
Yeah.
about it. So yes, and we spoke to IAPAC, which is the
Uh-huh.
International Association of Providers of AIDS Care. Gosh, I remember.
Yeah.
Um, and spoke to them about coming together and thinking about how to do it.
Yeah.
And it was a great experience. What I
Yeah.
would say is that it was the first year this year, and it was great to see. We had activities going on in America, South Africa, Ghana,
Yeah.
UK, but we also, for next year and years ahead, look, going to be just really galvanizing more collaboration, because we did a lot. It took us like 3 years, but things really picked the pace in the last couple of months. And
Yeah.
so in the next year, we want it, you know, bigger and better, more people involved, and more people to bring their ideas and say, we like this, we didn't like
Well,
this, we want more.
I think I'm gonna labour the point, you know, the fact that this came, you know, it's nice to see where this idea kind of came from, number one. Number two, I really got behind HIV Stigma Day because it really spoke to me. I mean, there's HIV and there's AIDS and there's wellness, but that stigma really spoke to me. And as a consequence, I went on to LinkedIn and I just put a really big post out. And that's because of Zero HIV Stigma Day. And it's so nice to speak to the person where that kind of, you know, that seed kind of started to grow. Now, what else did I was going to say to you? I just want to. I could talk to you all day long, you know, but I try and keep it to half an hour because I want to keep people kind of interested, and we can do another one later. But I just wanted to say, like, all today, like, I was thinking, what would I call this? What would I call this podcast? Because I like having labels on them, you know, like HIV and I thought to myself, I'm going to call it HIV and NHS because you're such a good, what's the word? Kind of reflection of the NHS, HIV, and how it can be or how it should be, you know, and how it feels, you know, to have that representation. I've got to make the point as well that my niece is studying to be a doctor. She just got her white coat and her stethoscopes.
Love it.
I want to ask you, Dr. Vanessa, have you got any, if you had to say, if there's anyone listening out there that have just kind of got a diagnosis of HIV, or if there's any friends or family who have found out that their, you know, loved ones have got HIV, what would you say to them?
I would say you're not alone.
Yeah.
Whether you're the person living with HIV or you're the family or network affected, I would say that the image that you have of HIV is likely not the true image of HIV and living with HIV today.
Yeah.
And we have come so far as a sector.
Yeah.
We have come so far in treatment. We have come so far in understanding the virus and what it does to the body. We have come so far in supporting people in living their best lives in terms of relationships, to have fulfilling relationships. Whether children is in your thought process, it's an option. You know, travel, work. You know, people worry even my life will be and needs to be limited by HIV, and that's the case. It does not have to be the case. But what I would say is that you're not alone, because there's a community of healthcare professionals, community organizations out there that are ready and waiting for you to reach out to. I think that's what I would say.
That's lovely. Huh? What was that?
As a start, that's what I would say.
That's lovely. Oh, thank you so much. Just one last point I've got to make. I love your hair. It's on point.
Oh, bless you. From Ghana. Yeah.
I can see it's lovely. All right, stay on the line. I'm just going to stop the recording. But thank you again. I love talking to you.
Thank you so much. Thank you so much.